when the spine has a problem that's basically a problem of stuck facet joints, that in the osteopathic world, that's what people call type 2 dysfunctions, or type 2 dysfunctions. And in a type 2 dysfunction, you've got two fundamental possibilities. You either have a possibility where at a particular junction of segments, the spine is side bent and rotated to the same side. So you have a place where the spine is side bent to the right, rotated to the right. Not that much, because that would be dislocation. Just a little. You have that, or you have a place where the spine isn't side bent, isn't rotated, but is just stuck in flexion or extension. So that's that. And then the only addition to that is that those places where the spine is stuck in side bending and rotating to the same side, it's also at the same time either stuck in flexion or extension. So in these type 2 dysfunctions, the spine is always either stuck in flexion, bending forward, or extension, bending back. Sometimes it's only that, and sometimes it's in addition to side bending and rotation to the same side.
And they are more following the rule of a side bend with rotation to the opposite side. So
like scoliosis.
Like a scoliosis. So if I'm in upright position and I side bend, I get across a broad area, my spine rotates to the opposite side. But little tiny, one or two, between two vertebrae, those facet joints, when there's a fixation, you get either stuck in extension, stuck in flexion, or stuck in extension or flexion, but there's a side bend and a rotation to the same side. And that's type 2. It's a localized facet joint.
So when we assess, when we feel people's spines, all we need to do is check to see, do I detect those things? Do I detect a place in the spine where it feels like it's bending forward too much, bending back too much? Or do I feel one of these places where it's side bent, rotated, and then I know, because I believe in the laws of spinal mechanics, I know that if I find that place where it's either stuck, where it's in side bending and rotation to the same side, I know it's either stuck in flexion or extension. I just have to decide which one. So far, so good. I mean, it sounds a little abstract, but this is the uber simple version. But wait, it gets better. What's even better than that is that, for the most part, in the vast majority of situations, when you see one of those places where there's side bending and rotation to the same side, if all you did was try to correct the part where they're either stuck in flexion or extension, and you didn't even worry about the side bending and the rotation, if you just do that, the vast majority of the time, that will be enough. Because really what you're doing is unlocking a joint fixation. And kind of like that thing yesterday with the pelvis and the pubic symphysis, if you just unlock the joint fixation, the segments will neutralize in all the planes that they need to neutralize in. Because the reason they were crooked, it's that phrase again, crooked and stiff. The reason they were crooked was that the facet joint was stuck. So what you're fundamentally trying to do is get the facet joint unstuck in the right place. But wait, it gets even better than that. Because what you're trying to do is unstick the place where it's stuck, even if you said, you know, side bend and rotation, it's stuck in flexion or extension, I can't decide, is it flexed or is it extended? And you bent it the wrong way, it would probably still work anyway, because you take the place where the facet joint is stuck and you get it outside of the range where it's stuck, and it would break loose a little bit and things would get more neutral. It's really very much like what we've just been doing with the sacrum. What you're doing is you're finding something, you're making an attempt to neutralize, you're coming back and checking and say, did I do it? If you did it, you go, yeah, I did. If you didn't do it, you go, huh, okay, that didn't happen. I guess I either did something wrong or I didn't do it long enough or whatever, and you try a little more. There's only one more thing, and I'll demonstrate shortly. There's only one more thing for me to add into this mix based on my experience. I've been trying to get good at this for a lot of years, and the reality, the fun reality is, over the last 2 or 3 years, I've gotten so much better at it. And the way that I do it keeps getting simpler. Isn't that good? Mm-hmm. I'd so much rather give you the simple version than all the complicated versions that I've done before. So the only thing for me to add into the mix is that often it proves to be true for me that if I try something and I feel like I'm only getting partial success, what I switch to, I go to their ankles, to a little traction, essentially, or pulling on the dura, sort of getting to the spine and tractioning a little bit. And then I come back and check how things coming with the spine. Probably it's better, maybe I'm done. But there's sort of a looping around. Feel something, try to change it. If I'm happy, I'm happy. If I'm not entirely happy, go to the ankles, a little traction, come back, check. That's the loop. Want to see me do it? Mm-hmm. Okay.